Mayor Slanka,
Here.
Mr. Richmond,
Here.
Ms. Zipsey,
Here.
Ms. Cash,
Here.
Dr. Zollett,
Here.
Ms. Lawley,
Here.
Mr. Bonnell,
Here.
Ms. Miller.
Here.
Thank you. Okay, so the first item on the agenda are our citizen comments. Do we have anybody here who'd like to make a comment today? Hearing none, yes?
None, but we do have a guest that, you wanna stand up and introduce yourself to us?
Good morning, yeah. So my name's Taylor, I'm a University of Cincinnati student in their family nurse practitioner program. I'm working over at the Primary Health Solutions both in Middletown and Hamilton, so thanks for having me.
Well, thank you very much for coming. Okay, so now we'll go ahead and receive and file the financial report. So do we have a motion to approve? Is there a second?
Second.
It has been properly moved and seconded. Is there any discussion? I had a bunch of questions, but we're gonna be talking about the budget as well, 'cause I guess I can wait for that in case this comes on. But just let me see here. Yeah, I'll go ahead and. For year to date, this would be
Mhm.
like, just several questions about how it kind of works. It looks like we're trending very well for the year. We're gonna end up in a good space, it looks like. So is that like the overall take on everything?
It is the overall take, and the last time, at the last board meeting, and that was, October, we, spoke about our budget, right? And how, we used to have carryover savings, and sometimes it's used, et cetera. And what has happened since then is the council had a budget meeting on the 28th, and I was there. You could look at that if you needed to, but we discussed the importance of public health. It appears we have very good support from our council to supply us with what we need and to allow us to have that carryover each and every year to kind of help stabilize us, if you will. And so we'll watch the budget really closely, but we had talked about what amount may be needed in the future. And I was saying around that $350,000 mark, but right now, this year, we have been supplanted with $250,000 from the opioid area, because that money, again, reminder, and we talked about this, with all the lawsuits that are coming to fruition, with all of the opioid activity, it was from everything that we did back in that whole, in, it wasn't pandemic, it was like that whole endemic time or whatever. So it was 14 to 16, I think, where we had the highest overdose deaths, overdoses, high infection rates of Hep A, C, HIV, et cetera. And the money was supposed to be used for EMS, for the runs, police, for the activity of drugs, courts, for all the courts and the drug courts and that they were going through, and health, because we were doing a lot of the harm reduction. Needle exchange, Narcan distribution, disease prevention, working with Cincinnati and Montgomery County at the time for all of the HIV activities, et cetera, working with the hospitals with infectious disease, et cetera, et cetera. So that money was given to us in the past. So when people say, what are you doing in the future? That was for the past, as we're getting this money rolling in. And again, for the future, for prevention and knowing how to stop diseases like spreading. I was trying to look at Chandra, as well as stopping deaths because of the Narcan distribution, et cetera. So it was agreed upon that night, and we did receive that for this year.
Mhm.
And anything else you want to add? But because it was discussion that night, budget at the council meeting, it was really good discussion. The mayor continues to support us, saying that, we really need police, fire, and healthy community, et cetera, so, yeah. So I think
Yes,
it's all good.
I think because just looking at revenue versus expenses, it looks like we will even end up under,
Yes,
right? So we have that
absolutely.
supplement for this year, which is wonderful,
Mhm.
but we are trending very, very well.
Very well,
For the
absolutely.
budget. I just had a question about other expenses here as well. It looks like we have about $41,000 going to other expenses. Just curious what's
Yes.
included in that.
And in other expenses, and again, I had given the mayor the old way that we used to do the budget, because other expenses category had all the other expenses we use or may use. Often we don't use it, but when we have a TB case, Butler County or all the counties in Ohio are responsible for TB, but the cities may have to go out and do direct observed therapy, may have to pay cost of drugs or whatever, and that is in there. We have a nurse in there just in case we have some kind of emergency where we have to hire a contractual nurse. We also have environmental, sanitarian in there, environmental health specialist in there, again, for emergencies. It's just contracted positions if we need to. And Carly, do you know anything that's come to mind for other professional services? I'm thinking that it's usually something that just in case we need it, we can use it. That account usually goes unspent. But Chandra, I used to have, like I said, in here, I could have brought it in here, Nancy usually has put on the side. We have, as you all know, that new accounting system. And so when we do the spreadsheet, it's little small print out to the side what those things are in there that we actually itemize in there. So I can get that for you, Mayor.
Yeah, it's nice
To
and,
get some of the other actual things that we use out of there, but other professional services is just a money, if you will, like that it's already been appropriated to us, so for an emergency, we don't have to go back to council to actually spend it, but it's usually not spent, but it is itemized in there what we would use that money for.
that's good, because, especially since with the health department, we really do have emergency situations.
Yes.
So like these are emergency services that we could use this money for. Just calling it other professional services, it's like, okay, what is that? But it makes sense, maybe we can call it something else too. Emergency. And like I said, it looks like we're tracking well. I think that's all I've got right now.
Yep.
Yeah. Okay, are there any other comments or questions regarding the finance report for October 2024? Hearing none, we would go ahead and proceed. Vote?
Mayor Slanka?
Yes.
Mr. Richmond?
Yes.
Ms. Zipse?
Yes.
Ms. Cash?
Yes.
Dr. Zollett?
Yes.
Ms. Lawley?
Yes.
Mr. Bonnell?
Yes.
Ms. Miller? Yes.
All right, the yeses have it. The motion passes. Thank you. So we will go on our agenda to new business with travel I'm sorry.
Did we skip minutes?
Oh, yes, we did. I didn't have it. Sorry about that.
Oh, we did.
Can we go back to that then? Forgive me, we did I skipped the minutes, approval of the minutes. So we have the approval for the minutes. Do I hear a motion to approve the minutes for October?
So moved.
Thank you. And is there a second?
Second.
It has been properly moved and seconded. Is there any discussion on the October minutes? Okay, hearing none, we'll proceed to vote. Thank you.
Mayor Slanka?
Yes.
Mr. Richmond?
Yes.
Ms. Zipse?
Yes.
Ms. Cash?
Yes.
Dr. Zollett?
Yes.
Ms. Lawley?
Yes.
Mr. Bonnell?
Yes.
Ms. Miller?
Yes.
All right, the ayes have it, that passes. And now we will move on to the next item on the agenda, which is new business and travel authorizations.
We have one travel authorization, and that is for environmental health specialist Nicole Pennington. She will be going to the OEHA, and that cost is in the packet. So,
$211.
yeah, $211. And this is for 2 days, correct, Carla? Yes.
Congress is not at a cost, it's just for mileage and
Oh, nice. Very good. Okay, wonderful. Anything else under travel authorizations? That's it? Sounds like that's it. Next is the budget discussion itself.
Do we have to vote?
Oh, we have to vote on that, okay. Is there a motion to approve the travel authorization?
So moved.
Is there a second?
Second.
It has been properly moved and seconded. Is there any discussion? Seeing none, we'll proceed to vote.
Mayor Slanka?
Yes.
Mr. Richmond?
Yes.
Ms. Zipse?
Yes.
Ms. Cash?
Yes.
Dr. Zollett?
Yes.
Ms. Lawley?
Yes.
Mr. Bonnell?
Yes.
Ms. Miller?
Yes.
Okay, the motion passes, as the yeses have it. And now we can move on to the budget discussion.
A little more information regarding the budget. We do have a succession plan that we are continually working on. FAB has us doing that as well. And when we were speaking at the budget meeting with council, we spoke about our department being pretty much the senior department in the building, if you will. Carla and I are both 27-year veterans. And I said veterans, it's been a war too, hasn't it? But no, and then we have Amanda and Nancy's 8 and 5 years or whatever. So as you go along, your personnel cost becomes heavier and heavier. As we start cycling through and bringing on new people, that helps the budget a lot. As well as we're thinking that some things will be changing in the future. We hope the state will start looking at higher subsidy for public health, because it is a lot of discussion at the state level of the importance of public health and the importance of public health being ready for different things. Right now, public health is very involved in Florida, doing all of the, after the storms, and doing tetanus, and doing different, things down. So it's just a lot of stuff that goes on with public health. And if you do public health, I'll say this over and over and over, well, you don't see public health, right? It's only when you see all these outbreaks or all the different things. But with pandemics and travel and et cetera, and vaccine concerns or whatever, we will start seeing emerging diseases, again, kind of coming back around. And it takes a little while for Chandra, that's why we try to keep our hands on nurses as much as possible, because it's always about vaccinations, or it's always about education, or maybe giving certain kind of medications, like antibiotics if we get into certain anthrax threats and et cetera. So we are always working on that. So I'm hoping the budget will ease up a little bit, and we'll start getting some funding for that, as well as when we start getting into when and if the state ever gets the death records online, where we can do statewide issuance. That too could help, because funeral homes may come to a smaller health department where they can get in and out, because they can get it anywhere versus going to the larger health departments. So sometimes you have those little shifts that kind of help the dollar amount. But the mayor here requested some of the benefits of local services, and so that's in your packet as well. We always keep this handy and updated. The importance of the night of the budget, well, not the discussion of the budget, but the council meeting when we were talking about health department, I received a call from one of our other departments that had a communicable disease, how to handle it, and it was 7:20. Usually you will not be able to get those kind of real-time services. I have Emily and Charlene's number on fast dial if I need anything, because you just need real-time information that you can't wait until 8 o'clock in the morning to get it the next day. You need to really find out what's going on. And Chandra has that all the time with the school nurses and kids that have maybe whooping cough, the pertussis or whatever. And you really need to start working before office hours, right? Because you gotta get a handle of your stuff. So I am really confident that as we move forward, we will be able to have a good balanced working budget, that we won't have to constantly keep going back and defending the budget, right? Because we usually are pretty frugal.
Mm-hmm.
But that is it. This is all in the packet. Dr. Zollett, anytime you want to come in and let's look and play with these and look at these numbers. I am trying to understand it. A lot of often you become a guru. I never like math, but you become a way that the numbers have to balance in order for, I guess, your auditor or whatever else, just like anybody else. They will not take a negative budget, right? You have to balance your budget. But there are so many different moving parts. I want to give kudos to this new council, city council, because you guys broke down the budget in front of people, kind of. If you look at that meeting, where they were trying to understand, what is this department, what is that department, what does this number mean? Where it was downtown funds, it's other funds, and you really don't know unless you've been doing them all your life. You really don't know what those mean, because it's not like Duke or the water bill. It's not that clear, right? It's different funds.
Yeah.
It's different enterprise funds, and what does enterprise mean and all that.
There's a lot of detail.
Yeah, it is a lot. So I appreciated that, because I learned a lot as well. So I think, as we had talked about earlier with the financial report, I think we are in pretty good shape, and we will continue to really watch our monies. When federal money gets money, it goes to the state gets money, it comes down to us, and that's how they usually try to get rid of their money. So we're hoping that we'll get another surplus of money by December, and that's not uncalled for, where everybody tries to balance their budgets from federal to state to down. So I think we're, unless you guys have any questions, I've tried to pick apart these numbers really good, and we've been working with finance department saying, well, where's our carryover? We have a health fund balance, and I'm like, well, where is it? We can't see it on this. And so often those numbers are locked too, those spreadsheets are locked. And so we can't get in there and pull information, we have to work directly with the finance department. And so we've been doing that, and I'm confident that, we're pretty much in good shape. Last month I was concerned.
We spoke about this before in another meeting, another health board meeting, but just looking at, again, kind of if you go back to the month of October, you'll see, indigent services,
Mhm.
we are already over budget for this year.
Yes.
We only have enough funds to cover 3 more services for the rest of the year. So just considering that, how are we looking for the budget next year for indigent services? Are we raising that? Are we taking this into account? What's with that?
I have to look, that budget, remember, indigent services is conducted, we do the administration of the indigent program, but it does not come out of our bottom line numbers, it doesn't come out of our numbers. It's a line item in the general fund. And so I will look in the general fund to see where if they landed or any more money, but usually what they do is appropriate it if it's going over, cause you can't predict it. And right now, I probably am cursing myself, but right now it's been quiet with, yeah. I am. It has been quiet. Sometimes we just get a lot of them.
We were
Right
so
now,
busy
we've been-
there.
Yeah, it was like sometimes 2 and 3 a week. It was kind of crazy. But right now we're quiet, so, I mean, you really just can't tell, so the years that go up and down. So we'll see, but it's just not, it won't be our concern as far as that, because it's something that municipalities must do. And so they'll just appropriate the money there.
All right, well, very good. Are there any other questions or comments about the budget for next year? Okay, hearing none, let's go ahead and continue. We're on to reports on the next item on our agenda. We will begin with our health commissioner.
Just a couple more things. I do believe that Ms. Cash, that graciously stepped in for our past board member, Dr. Patrick, the term is up, and this year. And so she said she'll do whatever we need her to do, but she really doesn't want to do it. So, look, she said, I'll do whatever you need to do, but I really don't want to do it. So, but she has just been simply wonderful. So we have 1 open seat on our board, and we have 2.5 applicants, and so we will get back with you. Yeah, 2.5. One called and said, is it a deadline? I know you're meeting tomorrow, because they went through all of this stuff online to look at the Board of Health or whatever, and they said it'll be here today. So that application, so what we do with that is we give the 3 applications to city council, and city council goes through them. And from what I know of the 3, they all are very interesting, very qualified. So it'll be up to the city council, and I will give them some of my opinions on it, but it's pretty exciting. So we will have a new board member starting in January.
And the council is having that discussion in December about boards and commissions in general. So yes, January will be.
Also, the Walk with the Doc was fun. Ruth was out with us again. We had Dr. Scott Rasmus from Mental Health Board, and he gave a very good message. And as we walked, it was another beautiful day, wasn't it? It was a gorgeous day. And he just went on and on. He's reported a couple of times in the county about how fun it was and what a good program it was, and invited people out to come. But he said it was nice walking through the community and hearing the history of the community and walking with the people. So it's great. It is the 2nd Saturday, is that correct, of the month at 9 o'clock, Rosa Parks. And it usually takes just an hour, depending how quickly you walk. You can run it.
It's a mile and a half.
Oh, nice.
Yeah, it's really good, and it's easy, isn't it? 'Cause
Oh,
we
yeah.
really, we really
Yeah, it
just get
doesn't
around
feel like
that,
it.
yeah. So come out, and I'll constantly keep putting that out, and we'll keep, and then Amanda will
I
call
told you to
Dr.
call me,
Zolla. I
you didn't
said she's
call.
gonna call you, 'cause it's fun. I think we should, have you talk about how easy it is to walk as we get older, right? Because I think it's a really good, you can walk or run, but it's a really good exercise to just be outside in the sun, conversing. You check out all the boxes of how you can stay healthy and connected, so that's another good one. It's just another good community
I have a
thing.
question about that.
Yes, ma'am.
How many people are showing up on average so far? It's very new still.
As little, I think 8 to 25, I think, so at
That's a
one
lot.
time we had a lot, we had 25 there a couple of times.
Mhm.
We have the normal people that come out are, what do you think, Ruth, about 12? The normal crew?
Yeah.
That's
The-
nice.
Yeah, but what, it just kind of, and there's a lot of things going on, sports and stuff, so we hope we pick it up. But, walking groups are just that, they're walking groups and people start coming on, it's like a book club and then you'll get your committed ones. My goal would be, to constantly keep getting community groups together, those connected, circles together, that you have fun. So, if you need to talk to someone, you can say, I can't wait to walk with the doc, cause I can see Ruth and I can talk to her about blank. So that's the way you start building these little bubbles of community that you get good resources and, trusted resources from, right? And so-
How soon in advance do we know who the guest doctor will be? Cause we can announce it during meetings, and do we also post it online, social
Yeah,
media?
we do. I can check with Beth, and it will probably be Ruth after a while. That's one of your chores. But, I know, yeah, but we can check and see. We're trying to get a lineup. It is always Dr. Feldman,
Mhm.
because she's the, thank you, Jeff. Have a good day. Dr. Feldman is the head of the Walking with the Doctor. She said she would spearhead it. So she's always there, and she'll always have a topic for us if we need one. But as we keep coming and prodding people, we'll just get new ones. So I'll try to get it out there, and hopefully it's a list. It is a Google tool that if people want to sign up for a speak,
Oh, nice.
then they can do it, and then you will start getting but I'll get back with you with that, because Beth Dorn with hospice is the one that was actually, what do you call it, is the captain, is the person. Foundation and the health department, we're all sponsors.
Do we know who's coming for December?
I don't think so.
Not yet.
I don't know yet.
Not
yet.
I haven't officially started.
Yes,
It's
I-
Monday.
It's a surprise.
So, yes, but
Yeah.
I will get that out to us as soon as possible.
All right.
Yeah. We should get Santa Claus. You have a red suit?
Hey!
There you go.
You got a red suit? He said
Thanks.
no.
You don't need to be the round jolly Santa, you can be a fit.
Yeah.
Yeah, there you go.
Big Santa.
With your little
Oh,
sneakers.
and how to eat and drink wisely at the holiday times. That would be good.
Eat the carrots, not the
And
cookies.
it'll be dressed warm.
Just, not what I do, just what you should do, huh?
Yeah. You do good.
As you have your cookies.
She said, eat the carrots, not the cookies. But that is it. We will be speaking tonight. Tonight is the mayor's city address.
The state of the city.
State of the city address. And she has given me a little help moment on there, so I'll be speaking along with the mayor, and it should be fun, and it should be a great event, so hopefully everybody will get out. And also on the 14th, which is Thursday, is the Red Carpet Luncheon, which is, it's the chamber that puts on this luncheon every month, but they're having all the health departments and all primary health solutions, the hospitals or whatever there. It's just like a health luncheon speak.
Where's that at?
Is that Fitton?
Mhm.
It's at the Fitton Center at kind of 11:30 to 1:30. One of the health commissioners were getting concerned, like, what are we gonna say? I said, we won't have enough time to worry about anything. Just be prepared, because it's all this panel, I'm like, we will never get through this. But just be prepared to say a little snippet about a little bit of everything, right? Because there's just so much to talk about. But Dan Bates, the president with the chamber, was wanting to kind of do this once a year. Kind of talk about the health state in Butler County, so that's what we're doing there. That's it, I think that's all.
Okay, great. We'll go ahead and continue with our medical director report.
Oh, can I stop
Wait,
1
yes.
minute? I'm sorry, I'm 1 minute. Yesterday was Veterans Day. We had a good speaker at the American Legion. It's important, Reverend Farrell was the Verity Award winner.
Mhm.
But the speaker, one of the things that I took away from that is although Veterans Day is one day, you come across veterans every day. Take the time to look at them in the eye, shake their hand, and thank them for their service, and welcome them back home. That was part of the speech. And I didn't know if we had any veterans on this board. We do not, and I didn't know if Jeff was one. But I just wanted to thank all the veterans that may be watching this for their service. even though it's just one day a year, they're amongst us every day of the year, and so make sure you thank them. So I just want to say that.
Thank
I'm
you.
sorry.
Yes, that was very moving.
Mhm.
All right, thank you. Okay, and now we shall go on to our report, our medical director report.
So this past month, we had 22 cases of chlamydia. There was an increase in COVID. Last month, we had 68 cases. We had 1 giardia, 18 gonorrhea, 2 pertussis cases. They were both unrelated cases. Strep pneumonia and a CRS case, which was in a resident outside of Middletown. CRS is an unusual bug because every other disease that we report on is assigned to us by our residents. So if you live on Central and you catch a disease, that is our case. CRS is different. CRS is assigned to where that person is diagnosed. So they go to Atrium, they get diagnosed, but they came from Warren. It's our case, technically. We don't have a lot of follow-up to do with that because it's in their home county that they have to do the follow-up, but the case gets assigned to us. It's a weird dynamic. I don't fully understand why they do that, but it's an oddity. So more times than not, any of the CRS cases that you guys will see on these reports, they do not belong to us personally. They're not in our residence. Nursing report wise, I did just go to the OPHA Public Health Nurse Section Conference, and Jackie talking about the subsidies. I did find out something very interesting is we get paid, Ohio gets 38 cents per capita for subsidy to the health departments, compared to our neighbor in Indiana gets almost $22 per capita. So that's why, you know, when Jackie talks about an increase in the subsidy, hopefully, that equity across the states is vast.
Can we just say that again? So Indiana, our neighbor.
Gets almost I get 21 something per capita to go to public health, and we get 38 cents per capita. Yeah.
Cents.
I was shocked. I mean, I knew we didn't get a lot, but I was shocked when I heard that.
That is shocking, stunning.
Now, let
So-
me give Ohio just a little bit of a break. Indiana just did that through the pandemic. The representatives, and they all just said, we need to make sure public health is prepared. So that was just in the recent years that they have put that kind of teeth into their budget. They've had a couple of things that were really scary. Do you guys remember that HIV outbreak they had in a rural country? Oh, it was terrible. It was a small rural county, and all of us, I mean, Ohio had to come in and help them because it was so much HIV. They were diagnosing it daily, and it was for drug IV use, it was during that time. But that's when they set up needle exchanges almost on every corner to try to combat that because there was so many people getting, contracting HIV. Which, you know, that's not, we're concerned about the rates, but usually you don't get concerned like that until you can get a handle on that. It's just like wildfire because it's a bloodborne
The
pathogen.
38 cents is a one-time payment a year,
Yeah,
and it goes, what, for the amount of people in the city, they have what, how do they get that?
58,
number?
like, so if your
How does it get the
population is
number?
51,000,
Oh my gosh,
it's times 38 cents.
incredible.
But yeah, I mean, that was with the speakers, that was the hope, is the fact that like Indiana saw value and increased theirs. The hope is that Ohio's gonna continue to follow that trend as well.
What we could do, you know, like the difference we could make.
Yeah.
It would be incredible. Is
So
there any-
there's hope.
Yeah, is there any talk about that kind of conversation, like what we might see? You had mentioned it, so.
They were just kind of giving us a broad stroke
Okay.
of, you know, policy changes and legislation changes and why it's important to be in these organizations to help kind of drive those policy changes, to keep public health viable.
And going back to the HIV outbreak in Indiana, how was that curtailed with the help of the needle exchanges? Is that what really made the difference?
Absolutely, absolutely. Because that's what they were doing. They could tell, I mean, you guys, it's amazing that usually the people that would share would be in clumps and groups or whatever, and you can really just stop. It's almost like when we look at, I know Emily knows, and we know, when you draw a circle around a group of people and you really take care of them, then it just stops. It's just like, it's that way with any infectious disease. You gotta get a circle around it, and then you gotta treat them, educate them, and make sure, and then it just goes away. And so that's what they had to do. They had to hit them hard with those different.
The packet had needle exchange for, I think, was it Middletown or
Mhm.
Butler County? But I didn't think we did that anymore.
We don't, Butler County does all of our needle exchange, and
So the numbers in there came from where?
they're coming from probably, I think they're Hamilton, Oxford, that's where they're doing the needle exchanges still.
So
The-
people from Middletown are going
To
to those
those
locations.
Fairfield?
Fairfield and
Yeah.
So
Oxford.
the Middletown number though, did it say Middletown?
Yeah, cause
Yeah.
they gather the data based on,
Right.
the
Zip
zip
code,
code
yeah.
the individual
Oh,
lives
that the
in.
person,
Yeah.
Mhm.
So that's why we have like a less, just under 50% return.
That returns the needles, yeah, cause they try to do that. It used to be a 1-for-1, and then now CDC says on needs basis, cause you know if there are users, and you can kinda tell, they usually give them a little more than one, especially cause they don't want them to share, et cetera.
Mhm.
And Butler County is still active in Middletown, just not exchanging syringes. They do HIV testing, Hep C testing, educational information,
Yeah,
and
this one
harm
actually has
reduction
like
supplies.
only a 30% return.
where's that though?
They do it around the gathering, they do it down by the Feed the Hungry, so they'll just come down and give
Oh.
out coffee, give, certain things and talk to them, so they're kind of just around the community more so, they don't do the actual exchange.
Is there any conversation about having the needle exchange back in Middletown?
I think Butler County, now that has the mobile unit,
Mhm.
they would love to do that and come back in and find a place to do that, they just haven't. They haven't actually found a place and gone through the whole process to do it, so they would love to. They could do it at any time that they are able to come, that they get the go-ahead. What they don't wanna do, when you have a needle exchange, you have to make sure all your city people are on board, because if you find somebody with paraphernalia, I think that is still illegal. And so, but if you have a needle exchange and the police knows it, and they know that they're just coming from an exchange, or if it's clean or whatever, they don't get in trouble, they don't get arrested, et cetera. It's a little process you have to kinda do to make sure everybody's on board with it.
So we used to have that?
Yeah.
Okay, so it can be done again.
Yes, it could be.
Okay.
Mhm.
Thank you.
On the public health emergency preparedness front, I will be sending out, save the dates in February. We're gonna be doing that chemical tabletop exercise that I mentioned last month. You do not actively have to participate if you don't want to. If you want to just observe and see what one of our tabletop exercises look like and how the questions that are asked, I would welcome you to come. It's gonna be I think the date is escaping me. I wanna say it's the second week in February, and it'll be from like 8 to noon. Here is the plan, hopefully in this room. But I have a couple things to hammer out with Butler County and Hamilton City. Since we share a lot of resources, sometimes it works better to play together, sometimes it doesn't. So you guys will all be getting an email about that. I would welcome your attendance. And then our Workforce 23 grant, we are done submitting invoices for this year, but that we're still waiting on instructions on a new chunk of money that they're wanting to give us for our accreditation process. It's $50,000, it's nothing to sneeze at, but we're just waiting. We put in our request for it, so that's where we stand with Workforce right now.
Thank you. Going back to syringes, I just had a quick question as well, with the needle exchange. It looks like on one of these reports, it says that Fairfield has a return rate of 116%. How does that happen? 116%. What are they doing that we could do? No idea. That's just interesting. Okay, all right.
116%.
I thought I saw that
I
on here.
know,
I could be reading it wrong, but it looked like it said 116%.
The only thing I can think is when we first
Oh, I
opened
see
up.
that,
Yeah, Fairfield.
Yeah, when we first opened the needle exchange, we could have had a return in that rate because people were picking up needles.
Oh,
Yeah.
So,
wow.
one-on-one, or if I got 2 for 2, And then on my way in, if I picked up other needles, cause you get more,
Yeah, the
right?
one-to-one is.
So you can return more.
Yeah,
Oh,
I can see that
wow.
happening.
yeah.
Well, that's
Mhm.
excellent, so.
That's part of the good thing about the
Right.
one-to-one, because then you're encouraging them to clean up.
Clean up and not
Yeah.
throw it away, right?
Yeah.
If we
Mhm.
do a needle exchange again, then that's like, okay, let's do that, cause that's a good.
It would be ideal, but I think that what the state says you have to just give out, right? You
Mhm.
just have to give out.
They usually do it only because with the CDC saying, if you really have a person that are an IV drug user,
Mhm.
okay, so understand this. If we were like Cincinnati and Columbus and Toledo that have multiple sites for needle exchange, Monday, Tuesday, Wednesday, Thursday, Friday, Saturday, Sunday, one for one makes sense.
Yeah, that's true,
But when you're coming once a week,
yeah.
Yeah,
and you know people are using drugs, you know they're gonna use that one needle over and over and over, or share,
Yeah,
right? And so that's the reason why CDC said, if you're, that's where you balance out, if you're just having a needle exchange every week, once every other week, you may wanna do it on a needs base
Yeah.
versus every day, because other places, they have multiple sites, and they can go to those multiple sites together.
that makes
also,
sense.
if multiple people in a house are using, sometimes they'll send one person to
Mhm.
go and get stuff for everybody.
Yeah.
That makes sense as well. Okay,
Yeah.
Thank you.
Mhm.
So, yeah.
Thank you for explaining that. All right, and, shall we continue, are we complete? Okay, for the next one, our environmental health director report.
Okay, for the month of October, we received 4 sets of plans. 3 of those were micro markets. And we have one, food service operation, which is a hibachi grill that plans, to go on grill. We have approved 5 sets of plans, in October, 3 micro markets, 1 mobile, and the hibachi grill, 1 FSO. We licensed 3 facilities, last month, 1 mobile and 2 micro markets. And I think, as I mentioned last month, our micro markets is just exploding, but our vending they're switching out micro markets for vending. I think, at the beginning of the year, we had 39 vending, now we have about 26, but the micro markets are increasing.
Tell them again, Carla, a little bit of the difference between the two.
Well, everybody knows what a vending machine, that we do vending machines for coffee and food, but the micro markets are like an unmanned convenience store.
Mhm.
So the employees, and they're usually in manufacturing facilities where you can go in and use your credit card and just pick out whatever you want. Let's see, our T21, we re-inspected, our facilities that needed re-inspecting, and so everyone is in compliance. We have about 70 facilities, and we sent out 70, new applications, and those applications have to be, in by December the 31st. So, we're on board with that. The inspectors, we inspected, we inspected 7, homes with, O&M inspections, last month. We sent out 686 septic letters for our O&M inspections. And those are steady coming in pretty well, Amanda. And those we'll start inspecting in 2025, the 686, septics. We had a festival, fall festival and a haunted house, so we had temporary events that we attended, in October. We have in the packet the, survey results. So for the, food service, which is Ohio Department of Health is in, control of that, we were approved, and we had no action plan, so that was great. Ohio Department of Agriculture, which is over the retail food, facilities, we were approved with an action plan. So we have to correct our ordinance. We had an ordinance that needed correcting, there were some mistakes in that. So the law department has that, and they're gonna review it, and.
Yeah, I just wanted to also commend you, that letter came in on the 11th, that we were like already answered by the 14th, that was like fast turnaround. So we have
Right.
45 days, right?
Right.
So
right.
excellent job there.
Thank you,
Yeah.
thank you. And we had a pool survey, which was done in 2023, which we finally got that. We were approved with no action plan, but they had some recommendations which we will implement with that. So I believe we have one more, result that needs to come in, and that's with the campground. I'm not sure why they didn't send it with the pool survey, cause those are done simultaneously, but we'll get that, so. Hopefully, done with surveys for this year, so.
I have a couple of questions. I mean, I know this one was addressed to.
I was gonna say.
Because it was
that's
done
when-
in 2023.
That was my question,
Right.
the former, board
Mayor.
president, so it
Mhm.
was like, oh, but that makes sense if
Yes.
it was done, but yes, just so, are they told?
They have the
that-
new one.
They have a new one, okay, good.
Yeah, they have,
That's wonderful.
Yeah, they
And-
always send a letter back to, and for the board to know, the mayor gets the results of all of our surveys, right? So she's the president of the board, and so the mayor gets it, and whoever the mayor is at the time, the letter is addressed to. So they don't change it until.
The next
So-
time.
And we put every year, if we have a gateway, and we put every year all of our employees in there, and all of the board members' names are in there. We have to update that yearly, so if they have any information, the state can contact you, and so it's your name in there, your profession, your background, contact, your email, anything's in there, because you're a part of the state, if you will, you're part of the boards of health in the state, so that's where they get the information as well.
Okay, and I had a question also, on the swimming pool survey worksheet, page 2 of 3. It says that there's an annual inspection,
Mhm.
right, and they allow for a window of 10 days. Did they, this one, like the June 17, 2020 to June 18, 2021, that was in, they didn't ding us for that.
They didn't ding us because it was during COVID.
They did not.
Yeah, right, correct.
Yeah,
I think
because
it
we
was-
had 10-day window, right?
Right.
So, but why'd they mention it then?
I think it's still because it's in, they want you to do that to inspect within 365 days.
Which we
They
did.
just get, huh?
Which we did.
Well, did we?
Well,
I
and
don't
one,
think-
plus one.
Well, but plus one,
Yeah.
it has, so you're only required to do one inspection per year, right?
Mhm.
Normally, we do more, but during COVID, it was kinda difficult to do that, cause, so,
COVID,
yeah.
Okay.
But they didn't ding us on that, so they, even with the
mentioned it.
food program, they mentioned it, but they didn't ding you on it because of COVID.
Okay.
Yeah.
And then, I'm sorry, are you complete or do you still have more?
No, that's it.
Okay, so I have a question about, could you go ahead and explain the smoking complaint spreadsheet? Because we had a violation contested and then one dismissed. I was just curious about those.
Can I see?
Commissioner Tabor?
Yeah, with the smoking complaints, you can always, contest the complaint. I think that one was, we got the complaint that they were vaping, in the facility, which is a violation, and you have that. But I believe it was after the deadline for the contest, so. And Hart Industries, I'm not sure what the violation was, but when she went, there was no she didn't observe anything.
How did that get reported? Did somebody
They
say?
anonymously,
Okay,
they
gotcha.
reported to the state,
Oh, wow.
yeah,
But it was dismissed.
Yeah.
it was dismissed, yeah,
Okay.
yeah.
And again, I'm sorry.
Oh, go ahead, at the square, I believe she did see them smoking when she walked in, so, the vaping,
Vaco.
yeah, it was vaping, which is a violation.
I always try to make sure everybody knows that the smoking is reported by customers. And when it's reported to by customers, it goes up to the state. And then the state reports to us that someone complained about somebody smoking. And they would ideally like us to go back to that facility at the same time the complaint was made. So if somebody complained at 7 PM at night, they really want you to go back because that might be when the activity is happening, so you can see that they're smoking, and then that's when we go back out to do the complaint. But then when people say, oh, this health department's getting on us, somebody's complaining in the community about a bar or a restaurant that's smoking.
Yeah.
Some places are smoking all the time and no one complains, and we don't know about it. So people say, how do you guys let that happen? We're not in that bar or restaurant, we don't know it's happening until you tell us it's happening. And so that's the way those complaints, and they don't call us directly, they call the state.
Oh, wow, okay.
And just, also, I wanted to mention too, with the pools, survey, we, like I think I started to mention, we only required to do one inspection per year. However, we can't do the inspection until the facilities calls us to do, that they're ready to open. So in order to not pass that 365 days, we really need to do at least 2 inspections per year so we won't go past 365 days.
And we did very well,
Well,
94% or something,
yeah,
that was
yeah, we
excellent,
did, yeah.
even with COVID, so.
Yeah, even
well
with
done.
it, yeah,
Yeah.
yep.
Okay, is there anything else to be said?
Yeah, and again, real quick, when Carla was speaking of, and I'm just telling us about the shifting of the revenue. We used to get temporaries every year. You have all these community events and people were setting up and cooking food. You remember how you used to go to carnivals and stuff all the time? Now, almost everybody's getting food trucks. That's one license a year. So instead of, you know, Emily or Chandra setting up every festival, that's 5 times that would be a fee. Now you have a food truck, you get a fee one time, and you can operate as many times you want to in the city. And a lot of the festivals and activities in our city are food trucks. So then again, your revenue may decrease that way too. Food trucks, you get increased revenue, but you don't get those temporaries that you would normally get. And so that's why sometimes those fees fluctuate a little as well. But I want you guys to hear too, it's a lot of activity that happens at the end of the year, and we get money in towards the end of the year. But at budget time, we don't have that revenue. So if it always looks like the revenue, it was mentioned one time that our revenue is not coming in, our revenue comes in December and in November. And so we don't have it at August, the budget time, but it comes in towards the end of the year or January at the beginning of the year, so. We are expecting more revenue in and have received, I think you received that too, and received more revenue since budget time. I think we had workforce development, we only had 42,000 in, and now we're at 70,000, 67,000 or something like that, because it comes in at different times. So, that's it. You will be approving the budget in December. That's the big thing that the board does every year in December. The council approves it first, and then we adopt the council's, you know, the budget from council in December. So we always need a quorum, so people can get paid in January. But
And just saying that you're very pleased with the budget, how it looks.
yes, I am. Yes, I am, please.
Okay. Is there anything else to be said under environmental health director report?
No, that's not.
All right, complete. Any other questions or comments? Okay, hearing none, we shall move on. Just for the board members' discussion, anything that anybody would like to bring up? Well, one thing I would like to mention, just to congratulate our health commissioner, Jackie Phillips Carter here, on being honored as a Her Story legend. Yes, it's a huge, huge honor. And everybody has this in their packet from the YWCA. It just says that this is an honor to recognize 10 women, total it looks like, for the inaugural Circle of Her Story Legends. So it's about women who show the values of compassion, diligence, sincerity, and unwavering determination to succeed. That is Jackie here, Mrs. Phillips Carter. So an innovator in not only in our own right, but also a catalyst for positive change in their family, community, and beyond, with an innate sense of empathy and inclusivity, and how she inspires others to join her in making a difference. And through her actions and dedication, she elevates the voices of women, celebrates diverse cultures, and champions equality for all. And so that is going to be, if you want to save the date, that will be March 8th, 2025. So next year. So we can put that in our calendars at Spooky Nook. So congratulations.
That's you. Thank you, thank you.
You are a gift to us all.
A friend of mine said, we're getting these awards because Sam got the Community Foundation Award. He said, are we dying or something? I said, I don't know. He said, these awards. I said, I know, are we dying? Are we? But I appreciate it. It was really sweet. I was really humbled by that from them.
Very deserving. Everything. So thank you. We are really lucky, blessed to have you here with us. And that's going to be recognized by everybody, so wonderful. And I did want to also just reiterate again, the commissioner mentioned it earlier, that we do have our State of the City address this evening. If you are able to attend, it'd be wonderful. You get like a little snapshot of what's going on, what's been going on in the city. It starts at 6 p.m. tonight at the Event Center of Middletown, which is Senior Center, 3907 Central Avenue. And we will have light refreshments, a little gift takeaway. We'll have the State of the City Health. We'll have the State of the Schools as well, plus the State of the City Address itself, and then also the Robert Sunnyhill Humanitarian Award as well at the end of the evening. So it will be really nice, a great way to see everyone and kind of get information on Middletown and celebrate Middletown. So if you are able to make it, and invite everyone, it's open to the public as well. And so that concludes it for me. Is there anything else anybody would like to bring up in open discussion? All right, hearing nothing, then we will go ahead and adjourn, and the next board meeting of, Board of Health meeting is scheduled for December 10th, 2024 at 7:30 a.m. Thank you all very much.
Thank you.